Hello, welcome to the lunchtime webinar with Life Chiropractic Centre. I am Dr. Jesse's. For most of you who are already practice members in our center, it's nice to see you here. This web talk or webinar series is part of our effort to get information to our practice members and people who are not currently under chiropractic care, get you information that can help you to deal with the most common questions that we get in our practice, in addition to hopefully providing some tips that can help reduce your overall stress exposure, which then obviously can help prevent you from having some of the symptoms and problems that do come up. So today is one of the, I would say, most common things that people do think about when they consider chiropractic care. And it's something because oftentimes people go to a chiropractor or see a chiropractor and they see spinal adjustments being done with the neck and the low back, so they think, okay, well, it must be something for pain, must be helping to reduce pain in the neck and the lower back. So people are always asking me about these aches and pains that they have. Actually, it is something that I would say for a while, every single time I went to some social function, inevitably somebody would come up to me and say, I know this is a social function, this isn't work, but I have this whatever, blank, fill in the blank for the question. And most often it comes with a question about neck pain or low back pain. So today I want to cover the basics of why low back pain and neck stiffness might be occurring. Pain, stiffness, tension. I'm going to use these things kind of interchangeably. I know it doesn't oftentimes feel like they are interchangeable or related, but if you do have stiffness or tension in the musculature and it's there for a prolonged period of time, it can eventually lead to some type of pain or discomfort. And if you say, well, yeah, I'm stiff, but I don't have pain or discomfort, it might be that you either have a high pain tolerance or that your body has just gotten so used to that tension that there is a certain desensitization of the pain sensory pathway. So today, unleashing neck and lower back pain, how to improve your posture, health, and life. And when I look at this from a perspective of what our practice members can get or the general public can get, it's really about understanding. The better you can understand what might potentially cause the problem, the better that you can be a proactive part in the solution. So before we begin, I'm going to go through a few questions. And some of this, for the people who are currently practice members, they're things that you're already aware of, and a lot of times we want to repeat. And the more we can repeat, hopefully the better it can help in that understanding, and the more it can help you to provide possible solutions. So this is sort of a self-check-in. Have you ever been under chiropractic care? If you haven't out there and you're watching this video, you might get a glimpse today about what chiropractic might be able to do to help you with certain aches, pains, and complaints. Are you certain about what it takes to be healthy? A lot of times I would say that people have a general knowledge and understanding about what it takes to be healthy. What I mean by that is generally we know that, okay, I should probably drink more water, I should get a little bit more sleep, I should probably exercise, I should probably eat a good balanced diet, I should probably reduce stress and have a positive mental mindset. So these things are understood as contributing factors to our overall health and wellness, but where I find the difficulty is the implication in trying to make, or not the implication of implementing, taking step towards making these a reality in our life. And that leads me to the next question. Are you 100% happy with your state of health? If you answer no, then this is a great opportunity to check in during this workshop and hopefully learning some more about what you could potentially do. And that's my hope. At the end of this, you'll have a better understanding about what you can do literally today, maybe even during this talk, that will help to limit the presentation of pain symptoms and tension, and hopefully helping you to live a healthier and happier life. So let's get into the content. Now, we talk about most of this. I look at it from a perspective of how you spend most of your time during the day. And we're looking at people who do generally have to sit. And a lot of times when I do this talk in a corporate setting, or I talk to my practice members about their work ergonomic position, most people do spend the majority of their day sitting. And when we look at that as well, think about how we recreate and what we do when we get home. It's like you spend the whole day spending long hours sitting, and then you get home and you're so fatigued and tired from work, you recreate by sitting on the couch or watching some TV or sitting. And so we live predominantly sedentary lives. So when we talk about essentials of your workplace wellness, what I'm also talking about is essentials of your daily living wellness. Whatever you do for the majority of your day, and with the majority of people that I do see, the majority of the hours they spend is sitting. So we want to get into what is involved with making sure that you have a healthier workplace, a healthier daily activities of daily living. And if we go through a brief overview, we can break it down into these 4 categories. Ergonomics, we're going to get a lot into what positive ergonomics are. Movement, healthy movement throughout the day, and I'm not talking about signing up for a marathon or a 10K or High Rocks or a gym membership. Literally just how do we pepper in movement into our day, which can definitely help to create more balanced workplace wellness. Managing stress, and then also how chiropractic care fits into that. And this is the thing, it's like, yes, of course, we do see people with aches, pains, and stiffness, but chiropractic care is about dealing with the master controlling system of the body. So what do I mean by that? Well, yes, we do help with neck pain. This is a spine, it's a model of the spine. This is the neck here, this is the mid-back, the thoracic spine, and then we also have the low back. So if people have low back pain, it's generally related to the pelvis, hips, or into that low back. Neck pain is generally from the upper part of the thoracic spine up to the skull. So when I say we're working with the master controlling system of the body, we use the spine. We help to improve the health of the spine, which then helps to improve nervous system function. So the brain communicates the messages from the brain through and over the spinal cord and then through the nerve rootlets. Every one of these nerve rootlets go to a different part of your body to help coordinate and orchestrate everything. If it's healing and recovery, if it's movement, if it's internal organ function, all of that information is communicated through and over the nervous system. So the healthier that your spine is, the better your nervous system works. So yes, of course, we can help deal with aches, pains, and stiffness with neck and low back, but we also help people to optimize their health, to heal better, to recover more quickly, to get better sleep. And all of this has to deal with improved nervous system function. We'll get into more in depth about that in just a moment. But first, I want to go over some of what the research and literature says about sedentary living. Like I said, we spend a lot of time at work sitting. We spend a lot of time at home sitting. So this study concluded that sitting is linked to higher mortality and cardiovascular disease risk in inactive adults. However, moderate to vigorous physical activity, meaning current guidelines, can reduce or eliminate this risk. So yes, in general, we sit too much as a population, and it can have deleterious effects. It can have negative impact on our overall health. But the positive is, if we get a little bit of movement, moderate to vigorous physical activity, you can reduce or eliminate the risk that sedentary lifestyle has on cardiovascular disease risk. So part of how your day-to-day with the sitting and the chronic repetitive stress of sitting affects your overall body is just about how you sit. That's first and foremost the thing. So I want to break it down from that in the beginning and looking at ergonomics, positive workplace ergonomics, and this is something that I'm sure many people have talked about or tried to optimize for their own health. Now, when we look at this, I will say a little story or interesting thing that we saw as chiropractors during COVID. So back in, in Singapore on April 7th, 2020, Singapore went into lockdown for 2 months. Nobody was allowed to leave their house unless they had a specific reason to go to the grocery store or to exercise. And during that time, our predominantly sedentary lifestyle increased astronomically, because what was generally built into the day as your commuting was then part of your physical movement through the day. So a lot of people who didn't do much exercise or would rely on that commute as their physical movement would spend even more time sitting. And because the body craves movement, and the more sedentary you are, the more stiffness and tension that's going to come, chiropractors saw a huge influx in low back pain, neck and shoulder stiffness, neck pain, because there was far more sitting, which creates more stress and tension into the body. So even before I go into the positive ergonomics, the biggest take-home message of that is we just have to figure out how to move and break up that seated routine. It doesn't matter if you have a $10,000 ergonomic setup, if you're using everything to the maximum of its capacity, but if you sit for 10 to 12 hours a day, you still have a potential to be sore and stiff, because muscles need to move in order to maintain their overall health. Joints have to move and go through full range of motion to maintain their overall health and not break down. But if we get down and look at ergonomics, having better workplace ergonomics can minimize the negative impact on the body of having to spend prolonged periods of time sitting. So these 4 categories, they help us to break down into bite-sized chunks so we can look at one and then kind of move into the other. So in general, you want to have a neutral spine. So going back to our model of the spine, what neutral means is that when we look at the spine from the front, we should be straight up and down. Mine is not very straight there. Straight up and down with a level pelvis. So that's a neutral spinal position from the front. If I lean over to one side, that's not neutral. The spine is going to curve. If I cross my legs, people always ask, is crossing legs okay? When you cross your legs, it's going to create a torsion and rotation in the pelvis. So crossing your legs can create some tension within the hip joint, the pelvis, or the low back, which over time manifests as stiffness and tension and potentially low back pain. So you want to think about neutral spine. From the side then, we look at the spine with a series of curves. A forward curve in the lumbar spine, the opposite curve in the mid-back. Sorry, my spine's a little out of alignment here. Opposite direction in the mid-back, and then forward curve in the neck. So when you look at the schematic here, you can see that the support that this person has is in that neutral spinal position from the side. There's a lumbar support to give you that little support where the spine curves forward. Her hips, elbow, shoulder, and ear are all in optimal alignment, straight up and down, to keep that neutral spinal position. Now, everything in your ergonomic setup is designed to keep you in as neutral of a spinal position as possible. So if we look at that schematic and we go to number 2, so neutral spine. Number 2, arms and hands in a neutral position. You want to keep your elbows as close to your side as possible. And what that means is, in many cases, if you're working on a laptop and you reach forward, the shoulders round forward, your head rolls forward. So you want to try to figure out a way where you can keep your elbows as close to your side as possible. One of the best tools that you can use to assist in this is to get a Bluetooth keyboard that you can pull closer to you so you don't have to reach forward. As soon as you reach forward, there starts to be adaptations and muscular tension patterns to support that posture. So I'm going to take a little break here to talk about posture. Posture in and of itself is not evil, meaning that I can sit like this, I can sit with the rounded shoulder, and doing this right now isn't creating problems in my spine. But if I hold this position, if I start to develop a habit of doing this over and over for hours, days, and even years, eventually my body will adapt to that position, and that then there creates problems. So what I mean by that is there is something called postural decay. If you're constantly reaching forward and working like this, eventually your body's going to lock into that position. Muscles are going to get tight. The tighter muscles are, the less the joints move, and the quicker they're going to break down. So being in a neutral spinal position is one component of that. And if you do have poor posture, getting movement in your spine is going to be the most important thing. Now, another thing with neutral arms and hands, oftentimes people will tell me, oh, I have this stiffness and tension in my upper shoulders, but that's where I store stress. And some of you maybe have said this before, I store stress in my shoulder. That's because when I'm working long hours at the end of a long day, the stress builds up into my shoulders. So this is partly true, but you're jumping to a conclusion that is just nonsensical. The part that is true is that you are working hard, and because of your hard work and focus, you're ignoring the body's symptom. You're ignoring the tight muscle. And as you ignore it, eventually that muscle continues to increase tension and stiffness to the point of causing you pain. Pain is a conscious event, meaning that it allocates brain power to think about and be conscious of that pain. So we are so good at ignoring early signs and symptoms. Muscle tension is an early sign and symptom. If you always have muscle tension, eventually you will have pain. And what happens when you bring those shoulders forward, the muscle that's supposed to stabilize the scapula, it's in between your shoulder blades, it's called your rhomboid. That muscle is lengthened and your shoulders round across that thoracic cage or that rib cage. And then the muscle that is supposed to stabilize the scapula, your rhomboid, if that's lengthened, it's going to be weakened or can't do its job as well. So then the superior trapezius, this muscle, your shoulder muscle here, that takes over to do the job. So your shoulders come forward and then that superior trapezius builds in tension, your shoulders rise up, and it just feels like this tension building throughout the day because of that prolonged sitting and rounded shoulders. So a little tip here, and we're going to go over this later, but I'm just going to use this time because we're on topic here. If you constantly get stiffness in your upper shoulder, what you want to do is as soon as you feel that, stop whatever it is you're doing and you're work to bring your shoulders back and down, like you're trying to put your shoulders in your back pocket. And when you do that and you bring the shoulders down and back, that superior trapezius will immediately soften. You cannot contract two opposing muscles. I mean, you can contract two opposing muscles at the same time, but if you're actively engaging the opposite muscle, pulling those shoulder blades down and back, the superior trapezius will relax. So not only does it help to decrease that muscular stiffness, but you're getting movement into that upper thoracic spine and that lower neck, opening up those muscles, which will help stimulate blood flow, which will then increase your ability to do your job because you're decreasing tension within that upper part. So all of this was a tangential direction, but related to position of your arms. Keep those elbows tight. Try not to reach forward. The closer they are here, the more neutral the spine, the better you're going to feel. Neutral legs and feet. You can see on the schematic there, feet are flat on the ground. And there's a negative angle from the hip to the knee. What that means is that the knee should be slightly lower than the pelvis. If the pelvis is lower and the knee is higher, it's going to be very reduced angle there. It's going to be tight in the hip flexor, and that can create hip tension, which then inadvertently leads to eventual potential knee problems or low back pain and stiffness. So you want your feet flat on the ground. I know some people, you have to cross your legs in order to be comfortable to work. If you have to do that, make sure that you're switching. Do a little on one side, switch to cross leg with the other one on top. But do your best to at least start in the position of feet flat on the ground, knees below your pelvis so you don't have such a steep angle at that hip joint, arms at the side, and then neutral monitor, keyboard, and mouse. Now, neutral monitor, what you want for the height of the monitor is that the top third of the monitor is even with your eyeballs. So generally you have to raise up your monitor to achieve that. If you work on a laptop, again, a Bluetooth keyboard will first and foremost allow you to pull that keyboard closer to you so you don't have to reach your arms. And secondly, what that does is it allows you to raise up your screen in order to make sure that that top third of the screen is even with your eyeballs. And actually, this is another interesting facts that I heard recently on the Alex Huberman podcast. He's a doctor of ophthalmology at Stanford Medical School. He does a bunch of research. His podcast is great for research-backed tips and tricks on day-to-day living. But one thing that he talked about recently in his podcast was that the position of the monitor has direct feedback into your wakefulness and alertness. What they looked at was that when you had an upward gaze, your eyelids are partly raised, so you look up with the monitor at that upper 1/3, it signaled to the brain for alertness or wakeness. As opposed to when the eyelids you're looking down and your eyelids are half closed, that started to decrease alertness. And it seems almost too simple, but it makes sense. If your eyes are starting to close, it's going to signal to your brain that it's time to sleep, or you're going to get tired, or a decreased alertness or readiness. So a very simple way to increase your ability to be alert and awake and focused is to have your monitor or the gaze in this upward fashion. Even if you just take a break and go walk outside and you're looking up towards the horizon or kind of keeping your eyes up above level from the ground, that will increase your alertness. So that's the 4. If you break down and look at how you stand, well, obviously then a standing desk is something that kind of solves a few of these problems with the hip joint and the knee and the feet. But these, you break it down no matter how you are sitting. If you have to sit at the kitchen table, if you have to sit at your desk at work, even if you don't have an ergonomic setup, it doesn't matter how much your chair costs. You can get a $10 chair off Carousel or free, and you can have a wooden table. You can put these recommendations or these categories about how to think about your position of your body in order to reduce the overall stress and tension for prolonged sitting. Neutral spine, position of our arms and hands, neutral legs and feet, and then the monitor being at the appropriate height. Now, then we get into refinement and optimal recommendations. I've already talked about a few of these, but then of course there are pro tips. Ergonomic mouse, laptop stand, and a standing work table. So at the laptop stand, this does exactly what I was talking about earlier. It raises the monitor up, the monitor part of the laptop, so that you're not looking down and being sucked into that monitor. The ergonomic mouse, what that does is it takes this position. So neutral postural position is when your palm is up. There's less twisting and tension there. This position with the mouse and kind of moving around creates stress rotation at your elbow. So a lot of times when I have patients who are doing a lot of mouse work, data entry from keyboard to mouse, they talk about pain on the lateral aspect of the elbow. And this might come into even the thumb. So it's along this outside of the arm, and that could potentially lead to, it might even start up in the neck, shoulder here, pain down the back of the shoulder and into the elbow. So this definitely can, to a certain extent, be alleviated by getting a mouse that turns your palm into this upright position and reduces the amount of twisting and rotation back at the elbow. And then standing workstation. We have a collaboration with a great company, a Singaporean company called OmniDesk. They have a desk, literally the one that I'm using right here, that goes up and down. And so for this, the general recommendation I would say is if you have to do your best work, majority of it sitting, then just break it up every once in a while with standing posture. Maybe there's some work, data entry or calls or meeting or something, video calls that you can do. You raise up your desk and you can stand. And the biggest thing, to go back to what I was saying, it's finding ways to break up that sedentary position of sitting that will yield you the best results, to reduce the amount of stress and tension that comes to those joints from lack of mobility. So, movement. That's the antidote. The antidote for workplace, neck, and low back discomfort from prolonged periods of sitting is movement. So then we have to think about trying to implement or pepper in little bits of movement through our day in the office. And the importance of movement helps to reduce muscular stiffness. I already talked a little bit about how that happens with the case of the superior trapezius. Strengthens musculature, especially if I'm doing postural exercises. It's impossible for me to go from a posture like this to a posture like this without developing the strength in those muscles to hold me in that upright position. So movement is how a muscle develops strength. We have to move. And then the other thing that movement does is it releases endorphins. And endorphins are the feel-good hormones. It's like if you've ever done a workout, you get done with the workout and you're like, yes, that felt great. That feeling comes from those hormones. It's a chemical equation in our body to hopefully help to motivate you to do healthy things again. So here's a few suggestions for workplace movement opportunities. We already talked about this, standing desk ergonomic chairs. Ergonomic chairs like the one I have here, another OmniDesk product. They are designed in order to keep you in that neutral spinal position to reduce the negative impact of that seated position. Walking meetings can be a great opportunity to break up the sedentary nature of your day. So if you and a colleague, if you're going to do a meeting that was sitting, or maybe a few colleagues, you can get up and do a walking meeting. Walk around the office. You can even go outside, get a little bit dose of vitamin D, maybe getting some sunlight. That can also help to perk you up a bit. Exercising at lunch. This obviously can be a challenge due to access to facilities, but if you have an opportunity to do exercise during lunch, it's going to dramatically reduce the negative impact of that sedentary position through the day. Access to fitness facilities, that's obviously can be a limitation, but finding one that's close to your area so you can pop out, and even if you just get like a 20-minute workout where your heart rate goes up between 120 beats to 140 beats per minute, it's highly effective to reduce the negative impact of the sitting. A movement room in the office. Again, this can be potential space allocation. In our center, and we are a chiropractic center, so we try to offer space for our team to be able to do these types of things. We have a few yoga mats that you can take into a room, or foam rollers, which I use a lot on myself. This stuff can be done just at your workplace. It doesn't require a lot of equipment or space. It just requires implementation doing it. Stretching breaks. This is something that is probably the easiest, lowest hanging fruit in order to have a dramatic impact on the negative impacts of your chronic repetitive sitting. And we're going to get into those stretching breaks and what you could do in order to help you in just a moment. And then the final thing, which also has a dramatic improvement on your ability to be healthy and well and reduce symptoms and pain, is active commuting. This could be something like riding your bike to work. It could be as simple as when you do commute, every time you encounter an escalator, you take the stairs instead. It could involve getting off the MRT or the bus one stop early and adding a little bit of walking. But what this does is, again, it's getting not only your heart rate going, but activating the musculature, bringing joints through ranges of motion. And like I had said several times before, these three things all improve the overall health of the spine, prevent degenerative changes from happening, and then can contribute to a healthier you. So let's get into the stretching break. So when we talk about stretching breaks, generally I would say that patients or practice members come to me and they say, I have a stiff muscle here and I stretch it and nothing seems to work. So the thing about a stiff muscle is that it's stiff for either two reasons. One, because it's overactive, it's having to contract to stabilize something, or it's overly stretched. So in both instances, if you are stretching into a muscle that is either overly active and kind of holding on tight, or it's tight because it's being chronically stretched, stretching isn't going to be the best way to activate or to help to reduce that overall stretch. The best way to reduce tension in a muscle is to activate the opposite muscle. So for instance, if we take the bicep flexes at the elbow, the tricep extends. So the best way to get my bicep to relax is to straighten and engage my tricep. To get my tricep to relax, I bend my elbow and engage my bicep. So then if we take this into, if you, again, tight shoulders here, bring your shoulders back and down, that causes that superior trapezius to relax. If you have really tight muscles at the base of your skull here because you're in this position, then what we want to do is a chin tuck, forcing that double chin, and it's bringing extension through that, or flexion into the upper part of the neck or the cervical spine, which can help that muscle to reduce. If you get tight through the front of the shoulders, your pectorals from reaching backwards and stretching out, or grabbing onto the table and rotating away, stretches out that pectoral and can help to reduce that tension in that muscle. So some of the stretches we have listed in the schematic on the PowerPoint, super simple, is just reaching up. Now when you do a trapezius stretch or this upper shoulder stretch, it's a good idea to grab onto the chair. So I'm grabbing onto the chair at this hand and I'm pulling in the opposite direction. So stabilizing and pulling, and you want to pull to your tolerance, not so it's so painful, but hold that for a period of 8 to 10 seconds and then you can relax. Do it on the opposite side. Now again, when I do it on the opposite side, I'm also contracting on this side, which can help to relax on that right side. Going through general ranges of motion. Oftentimes people ask me about cracking their own necks. Like you can see if you're in a Grab or a taxi and you see the uncle whip his head around and he's getting these clicks and pops in his neck, and they say, is that okay? Now, anything that is done as a habit can eventually cause problems. So when you're doing a self-manipulation, the joints that are making the clicking and popping are the joints that are already moving well, and you start to create this disparity of movement. What that means is that C4, 5, 6, they move the easiest. The more you crack and pop your neck, the more those joints are going to move, and the less they're going to move in these other areas of the spine. So in the long run, it will create more stiffness and tension. So in general, if you do have neck stiffness and tension, a good practice is to just get in that neutral spinal position and go through normal ranges of motion first. Just gentle, slow, controlled ranges of motion, because that helps to contract and relax the musculature around the neck. If you get to one motion, like if I bend here and it feels really tight, then you can work to stretch and hold that a little bit, and then continue to go through those ranges of motion. Shoulders, getting those arms moving can be extremely beneficial. So some of what we have here is literally just pulling across, holding. You can do both sides, coming up behind, bend the elbow and hold, and extending. Use your head to look up so that will feel a stretch in the the tricep, but also open up that shoulder mobility down into that, and switch both sides. Again, this is to get these joints moving that have been sedentary from prolonged work-related posture. And as soon as you get them moving, you'll start to feel the effects of increased blood flow. Joints, I can't reiterate this enough. Joints require movement for their overall health. A joint is an enclosed system. It's all wrapped up and there's a bunch of fluid on the inside of that joint capsule. That fluid on the inside of that joint capsule is nutrient-dense fluid. And when you move the joint, that nutrient-dense fluid is forced through those tissues, and it helps to maintain the overall health of the joint. So it's not just moving it for muscular activity. It is moving it to make sure that we can bring the nutrients into the tendons, the ligaments, and the joint capsule. So a little bit of stretch there. If we go into taking desk-bound breaks, these movements require a little more work. I will say that the best one that I highly recommend on this slide would be the squat, the body weight squat. You're just going from your chair to a standing position. You can do that. There was a study this study was referenced by Dr. Rhonda Patrick. She has another tremendous evidence-based podcast and talks about some of the latest research. And she called it movement snacks. And what the study looked at was taking 10 body weight squats for every 1 hour of sitting. And if you do that, 45 minutes. Sitting for 45 minutes, do 10 bodyweight squats. And if you're doing that through an 8-hour day, it's the equivalent of taking a 30-minute walk. The physiological benefit of a 30-minute walk had within, it literally took, I timed it, it took me 23 seconds to do 10 bodyweight squats. If you're doing that every 45 minutes, you're getting the same effect of a 30-minute walk. So activity breaks. The 28-2 rule has to do with how long you're sitting. If you sit for 20, stand for 8 minutes, move for 2 minutes. I know sometimes that doesn't seem like it's possible, but it's just figure out ways to build in movement into your day-to-day. Break up that routine. Going out, if you do start to feel that tension, use that body signal as your sign that you have to get up and move. Because if you don't get up and move and you ignore it, eventually that stiffness is going to develop into pain. And the importance of all of this, when we talk and look at spinal health and movement, the more we get movement into the spine, the more balanced our muscular tension patterns are, the better that your nervous system is going to work. We take a look at this, and I've talked about several times about the different areas of the spine and what they control. The healthier that these areas of the spine are, the healthier that the corresponding organs are going to be. So this is something that oftentimes people talk about, or questions. I mean, I say oftentimes because obviously I work in a chiropractic center where people are coming to me all the time with problems that they have, aches, pains, and stiffness. So they'll talk about these different ways and, oh, what can I do for this? What can I do for this? And I will say that with 90% of my recommendations, it's like, well, we have to figure out how to move this joint, how you're spending your day-to-day, doing an analysis, an audit of your movement, monitoring how you're spending the most of your time. Are there any patterns that pop out? Because if patterns are established and they're not addressed, eventually they start to lead into stress in the spine. So, and this is where we get to this whole like, well, you know, aches, pains, and stiffness come when I'm stressed. Well, generally when you're stressed and you're working very hard, you're super focused on your task at hand. That's your prefrontal cortex, your ability to focus and stay driven towards the task at hand. And that overrides these signs and symptoms of muscular tension and discomfort. So stress management is the best possible way to think about stress management is to manage it before it becomes stress. And I know this is the challenge, but discipline is the cornerstone of any health movement in your own life. Look at eating healthy food, staying hydrated, exercise, sleep. All of these things require a little bit of personal accountability. I can't come over there to your house and say, you need to do this. Personal accountability, and then also just doing it. It's not, if you wait for motivation, you're never going to do anything because motivation is fleeting. As soon as you get hungry, your motivation is out the window. So it has to be discipline. It can be as simple as just getting healthy movement into the spine to reduce the physical stress on your spine, which then can just help you to feel better. And once you start to feel better, then there will feel like there's less stress piling on top of you. So stress in the spine shows up as postural adaptation. If we see people with their rounded spine and tension, we talked about how that affects overall spinal health and nervous system health. And spinal health is directly related to the presence of pain, symptoms, and tension. And sometimes there can be somebody who has poor posture and doesn't have pain or symptoms, but that's a great opportunity to check out to see if there are these underlying conditions that may manifest into other problems. Because if there is misalignments in the posture, it definitely can show up in the underlying spine. In the underlying spine, this is a thing. If there is tension in the spine that isn't appropriately addressed, the spine does break down. This is degenerative change. Spinal degeneration, or degenerative joint disease, or degenerative disc disease. The thing about degeneration is that it is preventable. I talked about this before, where the movement of the joint helps to maintain the overall health of the joint. A disc Anybody who has a slipped disc or a blown disc, the disc is made up of a cartilage much like your ear, which is mostly water. And as soon as those joints get stuck and aren't moving, that disc becomes susceptible to injury. So we have to be able to take a look at what's going on in the health of the spine, how it relates to your habits. In this workshop, directly dealing with ergonomics and how you sit or how you don't sit with movements throughout the day. And then most importantly, how all of that implicates the neurological tissues underneath, and how can we leverage that, improve spinal health, or improve ergonomics, improve spinal health, improve nervous system function so that you can feel better. Not only feel better, but you can heal better. You can be more adaptive to this environments around you and make sure that this isn't something that pops up as a problem down the road. So I know that I went over a lot of information there, and hopefully you got a few bits of usable information and give you a direction that you can move in on how to reduce the overall stress and tension in your spine from chronic repetitive stress. The biggest thing, and I've repeated this over and over, but if sitting creates the problem, then movement is the antidote. And often I make the joke of, well, if it's your job that's creating the pain, then you just got to quit your job. And yeah, it's kind of funny, but it's also, isn't a reality. We have to figure out how to live our life with creating healthy habits in the life that we currently have so that we can continue to do the things that we have to do. Yes, obviously, if there are changes you can make to work that then have a positive impact of how your body is, I think it's something that is easy to do and something that would have a high value that is going to create some positive changes for you. So with that, I appreciate your time on this lunchtime webinar. Please do follow us on social media, our Instagram account. We post a lot of videos on IG or YouTube giving you tips and tricks on how to minimize your aches and pains on your own. And if it is something to where you feel like you're just not getting through, or you've plateaued and there's this pain that has just been nagging, or this chronic stiffness that you can't address on your own, then don't hesitate to come in. If you're already a practice member and you still have some of these aches and pains, or don't hesitate to bring it up at your next adjustment. We'll troubleshoot it and we'll help you to get what you need in order to be a proactive participant in yourself feeling better. I'm here to assist people achieve their best optimal health, and we do that through breaking it down, finding the right pieces of the puzzle in order to help you to not only feel great, but to heal great. So with that, I'm going to wrap up the webinar. If you do have any questions, you can pop it in the chat box and I'll do my best to answer those before we go. So, thank you all for paying attention. We look forward to either seeing you in our clinic at one of our in-person workshops or on the next webinar here on YouTube Live. So, no questions coming through? Fantastic. I appreciate your time. Hope you all have a great day.